morning. This is the special coverage of the coronavirus crisis using the combined forces of News 5 and Signal TV's One News, Radio 5, and One PH. Rizal Governor Nini Inares has tested positive for COVID-19. This was confirmed by his son June Inares, adding that she is now in stable condition, though under quarantine. June says the governor may have contracted the virus while doing rounds in the province. Among the people she had interacted with in the past 2 weeks was Antipolo Mayor Andeng Inares. The Makati Medical Center has denounced Senator Coco Pimentel's alleged breach of infection and containment protocols of the hospital against COVID-19. To talk to us more about this, we have with us on the line Makati Medical Center's Medical Director, Dr. Saturnino Javier. Doctor, thank you for joining us.
Thank you. Good evening.
Good evening po. Doctor, I understand po na may protocols po when it comes to medical workers being in contact with people who are positive. Ilan po yung naapektuhan sa inyong mga staffers dun sa pagbisita ni Senator Coco Pimentel?
Roughly po, 6 to 8 people yung na-involved. But keep in mind that those 6 to 8 people will also have interactions with other people, no?
Opo.
And down the line, lahat po naman yan tinitrace, no? But I would think the directly involved people are around 6 to 8 people.
6 to 8 people. So these are people whose work will now be sidelined, I suppose, because of what happened.
Hindi naman po lahat, because the exposure comes in different degrees. No?
Opo.
Meron tayong tinatawag ng low risk level of exposure, medium risk, and then high risk. No?
Opo.
And depende po sa exposure that they incur, the recommendations will follow insofar as quarantine procedures are concerned. Doon po sa aming nakita kanina, maybe around 2 to 3 people are categorized as low-risk exposure. So they have been certified fit to go to work again.
Okay, that's good.
Maybe 2 people will be quarantined, but the rest are certified to go back.
Okay, that's good, sir. Pero sir, ang sinasabi ni Senator Coco Pimentel, at least yung sinabi dun sa reporter namin earlier, hindi raw siya pumasok ng delivery room. Sir, Doctor, what to your knowledge were the circumstances behind the visit, the details that you know of?
He probably meant the actual delivery room, no? Pero yun po kasi aming delivery room, a delivery room complex. No?
Opo.
It has a foyer, it has an examination room, and then katabi na po niyan yung mga delivery rooms. No? So, even if you don't enter the delivery room itself, just by being in the foyer and you communicate with our front desk personnel, naturally, yun pong exposure na yun, the front desk personnel there will naturally have to interact with other people in the unit. No?
Opo.
So it behooves to accept that when you are exposed to that kind of environment, the whole area will have to be decontaminated and disinfected.
Doctor, ano po, I think it was, yes, Justice Secretary Minada Guevara who was asked about what happened dun sa Makati Medical Center, and he was asked particularly if Senator Coco Pimentel is liable for, legally liable for what happened last night. Ang sagot po ni Justice Guevara, it all depends po dun sa possible complainants. So,
Right.
Then the next question would be, what is Makati Medical Center's plan with regard to this? Are you going to pursue anything in particular?
Well, this is a sensitive matter, and I leave that to the legal bright minds of Makati Med to deal with. I think the fact on hand to guide us on what will be the next step to follow.
Okay, sir. Doctor, one more thing before we let you go. Tell us about the situation now in Makati Med. How are you coping with the crisis? Do you have enough equipment, enough personnel? How many are in quarantine, and do you have any personnel who have been infected?
Nag-declare na po kami ng full capacity
Opo.
of last night officially. Pero marami pa rin po kaming dumarating na PUI or persons under investigation. We're trying to find some other places where we can transfer them. Some are still staying in our emergency room. No? At the moment, we have around 17 or 18 positive COVID cases in our designated COVID zones. No?
Opo.
So far po, we're still able to have a good match between the number of the patients and the number of our healthcare personnel. Kaya nga po, very crucial sa amin that if our workforce contingency ay mabawasan because of undue exposure, malaking bagay po sa amin yun. Kaya po, paulit-ulit kami, we hope that everyone will contribute to the solution of the problem and not add to the burden of the situation.
Do you have any message that you want to send to Senator Pimentel as of now?
Well, I think I've said enough in the official statement that we made. Pero ang gusto ko lang iparating sa general public about Makati Medical Center is that we've been able to decontaminate the entire area. The delivery room complex is now back to its full operating processes. All the necessary personnel who needs to be tracked have been traced. Therefore, everything is in place insofar as measures are again in place.
Okay. Maraming salamat po, Dr. Saturnino Javier. Doctor, please convey our gratitude to your staff for what you're doing. Maraming salamat
Thank
po.
you very much. Thank you. Thank you.
Umalma ang ilang residente sa isang barangay sa San Mateo, Rizal matapos gawing quarantine area ang isang lumang health center sa loob ng pribadong subdivision. Para sa detalye, nagbabalita live mula sa San Mateo, Rizal si Lynn Olabario. Lynn.
Bok, nangangamba ang ilang mga residente ng Armel 2 Subdivision, Barangay Banaba, San Mateo, Rizal dahil yung kanilang barangay ay naglagay ng mga persons under monitoring sa isang lumang health center sa kanilang subdivision. Lunes daw ng gabi nang dalhin ang mga PUM sa lumang center sa Magnolia Street. Halos 6 na taon na raw na hindi ginagamit ang center na ito. Ayon sa ilang residente, hindi raw magandang sa loob ng private subdivision maglalagay ng quarantine area dahil paano kung mahawa sila. May nagsasabi rin na hindi nirespeto ang homeowners ng subdivision dahil hindi man lang daw sila inabisuhan na maglalagay ng mga PUM. Labas-pasok din daw sa subdivision at wala namang PPE maliban sa mga face mask ang mga tanod na nagbabantay sa labas ng quarantine center. Paliwanag naman ng Barangay Disaster Risk Reduction and Management Office, totoong may 3 PUM na dinala doon. Masyado raw kasing maliit ang mga bahay nila at mas advisable kung doon sila sa malaking lugar ika-quarantine at malayo sa karamihan. Nilinis rin daw ang lumang health clinic na iyon bago gamitin. May doctor, nurse at barangay health emergency responders team daw na regular na nag-check sa mga PUM habang ang mga tanod ay sa labas lang at iniiwan lang ang pagkain ng mga PUM sa pintuan at hindi nakakasalamuha ang PUM. Wala rin daw dapat ikatakot ang mga residente. Aniya, nagsimula raw ang takot nang may mag-post sa Facebook na may namatay na doon at merong naghihingalo na mariin nilang pinabubulaanan. Sa katunayan raw ay wala pang nagpositibo sa COVID sa Barangay Banaba. Merong 2 PUI at 12 na PUM. At dapat raw sundin nila ang quarantine at manatili sa bahay para manatiling ligtas. Bok, base sa DILG Memo 023, yung barangay yung inaatasan na mag-identify ng mga barangay isolation unit. Pero ayon din sa nakausap nating BDRRMO head na si Bobet Jacinto, kakausapin niya yung mga residente para maipaliwanag yung sitwasyon at para maibsan yung kanilang mga pangamba. Bok.
Lynn, yung nagdesisyon ba na maglagay dyan ng quarantine site ay yung Barangay Banaba o yung San Mateo LGU mismo?
Bok, pumunta tayo dito kanina sa munisipyo. Ang sabi sa atin nga, per yung DILG memo, ay yung barangay talaga kumbaga sila yung assigned na mag-identify kung saan sila maglalagay ng mga barangay isolation unit nila. So, yung barangay yung nagdala doon.
Okay. Maraming salamat. Lynn Olabario live mula sa San Mateo, Rizal. Alagang Kapatid Foundation is giving out care packages and hygiene kits to 7 hospitals around Metro Manila. Among these are COVID-designated hospitals, Lung Center, PGH, and Dr. Jose Rodriguez Hospital. Alagang Kapatid is also distributing food packs from One Meralco Foundation and hygiene kits from PLDT Smart Foundation to marginalized families. Meanwhile, PLDT is offering free voice and data connectivity to certain municipal and provincial command centers. Hospitals under the MVP group, like the Makati Medical Center and Cardinal Santos Medical Center, are also in the front line against COVID-19. And that's the latest on the enhanced and expanded community quarantine in Luzon. For more updates, follow News 5, the Philippine Star, and Business World Online. I'm Ed Lingao. We are One News.